Hi, Dr. Tim Swift here. I just wanted to talk about a case that I saw recently last week, and we reviewed some of her after films, which were really exciting, but I wanted to talk about what she came in with. This is a patient that came in. She had had 5 years of chronic pain daily. She had already seen quite a few providers, PT, chiropractic. She'd already visited 2 spinal surgeons, and she wasn't getting any answers, and she wasn't getting any relief. She heard about us, was referred in. We always love referrals. She came in, and the first step in any case, just like everyone else, we took a set of films. We want to understand what's going on. Now, during her physical exam, we found that she had problems at her L5 disc and her L3 disc. So after we took the images, we were very curious, okay, what do these discs look like? So here we are, the side view, and this tells us a lot about the condition of the discs. But when we look at this side view, what we'll see, as I zoom in, I'm going to give you a demonstration here of what we're seeing here. So this right here, if we zoom in, this right here, that's a normal-ish disc. It's not quite normal. It's a little thin here at the back. Down here, perhaps more of a normal disc right there. But if you'll notice the difference between this disc above and this disc below, you'll see a dramatic difference. This disc below is degenerated. We have spurs in the back. We have spurs in the front. This is going through a process of decay and degeneration, arthritis. Now, this patient was very young to have this, but she was having it. And as we looked at the L5 actually was in way better condition than the L3. It has plenty of disc, but it also was inflamed, and if not taken care of, it very likely would end up in the same situation as L3. We were curious about how did this L3 move? So we had her bend right and left. So as she bent to the right, we can see that she bent very nicely and smoothly. You can see the curve is carried right through that 3 in this area. So we had her bend to the left. This is where we discovered the problems. When she bent to the left, you can see it's bending down here, but then it's buckling. It's very straight right through this level. This is how we determine how we're going to approach her spine. And in her case, we needed to approach her from the left-hand side. We needed to restore that motion and help with that degenerated disc, rehabilitate it the proper way. Now, chiropractic alone will do a lot. In fact, in the period of time that we saw her, we were able to eliminate the pain, get her back to her normal functions. She's not having daily pain anymore, and she's able to feel like she has normal life. She's not scared all the time that her back's going to go out. So she's doing really well. And she's actually decided at this point to move forward with dealing some of the underlying degeneration arthritis through the use of regeneration stem cells. So we're really excited about seeing cases like this. I prefer challenging cases because it keeps things fresh. After doing this for 23 years, standard back pain is relatively easy. The more challenging cases are a little more exciting, but either way, we're happy to help. So if you have a problem that maybe you've seen other clinicians, you've seen other doctors, you haven't had good results, come in. Let's do a workup. Let's truly understand not just what the condition of the spine looks like, but also the functionality and what's happening with your spine, whether it's moving, whether it's not moving. And this is something we can sit down together, we can look at together, and we can discuss what we can do to fix you. I hope you find this interesting.